In Henderson County, North Carolina, a storm has been brewing, not of clouds and thunder, but of pertussis bacteria, commonly known as whooping cough. Since last month, an unusually high number of cases has rattled this typically serene community, highlighting the shadowy resilience of infectious diseases, even in an era resplendent with medical advancements. There, amidst lush green landscapes that usually call to mind peace and quiet, pertussis's telltale whoop is causing a different kind of disturbance, a reminder that humanity is never truly beyond the reach of nature's caprices. As we wade through the veil of this recent outbreak, it becomes clear that Henderson County's encounter with pertussis is not just a local health issue, but a crucial node in the extensive web of global public health challenges. While families grapple with the disease, scrambling between doctor visits and home caregiving, the outbreak tears at the threads of community life and raises pressing questions regarding our collective health responsibilities. Henderson County first noticed a spike in whooping cough cases in early March, a surge that baffled local health authorities. Initial cases have been clustered around local schools, a typical ground zero for pertussis outbreaks. Pertussis is known for its capacity to masquerade as a common cold before escalating into severe uncontrollable coughing fits that can last for weeks. Investigations suggest that the reemergence of this preventable disease might be traced to decreased vaccination rates within the community. Recent years have seen a slight yet significant drop in vaccination coverage, a trend influenced by vaccine hesitancy and misinformation spreading through social media platforms. Some experts and epidemiologists suggest that, in some communities where vaccination is not consistently upheld, highly contagious diseases like pertussis find fertile ground to grow. Indeed, the mechanics of a pertussis outbreak underscore a larger, global challenge: the balancing act between individual choices and public health safety. At the heart of any health crisis are the people it affects directly. For instance, one young boy, only 8 years old, contracted pertussis despite having his vaccinations up to date, and a young mother was terrifying to see him struggle for breath, her voice a mixture of fear and frustration. He would cough so hard, he would turn red. I felt so helpless. His experience highlights an important aspect of pertussis vaccination significantly reduces the severity of the disease, even if it does not always prevent infection entirely. Amidst personal narratives, the surge in hospital visits mirrors the broader turmoil in the community. Local hospitals have set up special wards to deal with the increase in severe cases, often involving very young children and the elderly, groups that are particularly vulnerable. In these narratives, there is a repeated emphasis on the community ethos, a sense of shared responsibility that is especially palpable in times of crisis. This is reflected in the rising volunteer numbers and community-led initiatives providing support to affected families. To shed light on the outbreak, we turn to medical experts who explain pertussis as a cyclical beast. Doctors that specialize in infectious disease suggest that pertussis outbreaks tend to occur in cycles every 3 to 5 years, despite vaccination efforts. This cyclical nature can give a false sense of security during dormant periods, leading to complacency in vaccination drives. The bacterium Bordetella pertussis causes whooping cough. It attaches to the cilia of the respiratory tract, producing toxins that result in inflammation and severe coughing. The cough itself is a desperate reflex to clear one's airways, making it not just a symptom, but also a transmitter of the disease, which highlights the need for strict isolation of affected individuals. Experts stress that while antibiotics are effective in reducing the period of Bordetella pertussis transmission, they do little to ameliorate symptoms in later stages. This underscores the importance of early detection and the critical role of preventive measures, particularly vaccination. Addressing an outbreak involves a clear understanding of both the illness and the societal behaviors that surround its spread. Henderson County has already begun to bolster its defenses against pertussis, with enhanced public health campaigns focused on the importance of vaccination and the correct information regarding its safety and efficacy. Vaccine clinics have sprouted throughout the community, offering free vaccinations and educational sessions to alleviate fears and debunk myths. Local schools have introduced mandatory health checks and are collaborating with health experts to integrate disease prevention into their educational programs. Furthermore, the recent outbreak serves as a potent reminder of the continuous necessity for public health, vigilance, and adaptation. Future strategies are expected to involve more robust tracking systems for vaccination histories and possibly exploring advancements in vaccine technology that could offer more durable protection against pertussis. As Henderson County battles this pertussis outbreak, the episode is yet another chapter in the ongoing narrative of our interaction with the microbial world. It is a stark reminder that public health requires not just good science, but a community's commitment to acting on that science.